So guys, having discussed the incoming and the outgoing tributaries of the cavernous sinus, now it's time to look at the cavernous sinus and its relations in the coronal section. We need to understand the relations of cavernous sinus because not only many cranial nerves are related to it. In fact, the anti-relation of cavernous sinus is extremely important to understand one of the clinical implication called as pulsating exophthalmos. So to understand cavernous sinus relation, let's consider a coronal section and the section which is exactly from the middle cranial fossa through sella turcica. So here we go. That this here, let's say, is the body of the sphenoid bone. That's the body of the sphenoid, and these are the sphenoidal air sinuses inside. So here's the sphenoidal air sinus. Obviously, this depression here is what? The depression is the sella turcica, that is pituitary fossa or sella turcica, where you will see this pituitary gland present. This here is the neurohypophysis, and let's say this is the adenohypophysis. Now, where exactly cavernous sinus is placed? It is just lateral to the pituitary fossa as well as pituitary gland. So, in this, if I have to draw the cavernous sinus here, it will be something like this. So, that's the coronal section through cavernous sinus. It's present in the middle cranial fossa and very close to the midline, as we said. I mean, it's on either side of the pituitary fossa, but yeah, still close to the midline only. And the foramen which is present in the floor of cavernous sinus, which will also help you understand what structures goes inside, is the internal carotid artery, which is the content inside, because in the floor of cavernous sinus we have foramen lacerum. So this here is the foramen lacerum. If you know about foramen lacerum, it is one foramen in the skull which is not an opening present in the bone. It is basically a space left between the bones. So you have a petrous part of temporal bone, you have a squamous part of temporal bone, you have a sphenoid bone. So kind of it's a when the bone are developing, there's a space left in between them, and that gives rise to the foramen lacerum. So unlike other foramen like foramen ovale or carotid canal, it's not a typical foramen present inside a bone. It is a space left between the bone, and it is usually covered with a fibrocartilage on the undersurface. Okay, something from our previous discussion only, that we said the nerves which are present in the lateral wall of cavernous sinus. So we said it is a third nerve, we got fourth nerve, and we even have ophthalmic nerve in the lateral wall. So there is this third nerve, fourth nerve, and we got ophthalmic nerve all in the lateral wall. In majority of the textbook of anatomy, they say the maxillary nerve is also present in the lateral wall, but we'll go with as per Gray's 41st edition, which mentioned that the maxillary nerve is not present in the lateral wall of cavernous sinus, is present below the level of cavernous sinus. It's exact statement which is given in the 41st edition of Gray's, and in fact I should emphasize on this point that maxillary nerve is not in lateral wall of cavernous sinus. I'm making you write this because when you read any basic textbook of anatomy, BDC or Snell's or any, everywhere they mention the maxillary nerve is also there, but Gray's even they show a picture also in which they are try to figure out that how exactly maxillary nerve is outside the relation of cavernous sinus and not in the lateral wall. So it is not in the lateral wall of cavernous sinus. So that's a statement according to Gray's 41st. One nerve, we discussed the nerve which is inside the cavernous sinus, and that nerve was the sixth nerve, that is abductor nerve, along with internal carotid artery. Just make sure the nerve lies inferior lateral to the artery. So here we have, that is the sixth nerve, that is the sixth nerve, and along with the internal carotid artery. See, that makes sense, guys. Internal carotid artery enters the cranial cavity through carotid canal. Carotid canal is a canal present in the petrous part of temporal bone. So there's a canal from below from which the internal carotid artery enters. Then the thing with carotid canal is carotid canal overlaps foramen lacerum. So whatever content we have in the carotid canal, they will ultimately go into the upper part of the foramen lacerum only. Foramen lacerum is present in the floor of cavernous sinus. So if the internal carotid artery is reaching here, so obviously internal carotid artery will also be going inside the cavernous sinus also. That's why it is inside cavernous sinus and not anywhere else. But as we know, internal carotid artery has to supply the brain. So just staying inside the cavernous sinus will not help. What internal carotid artery will do, it will go inside the cavernous sinus, it goes forward, it comes backward and then goes into the brain. And this is called as a carotid siphon. Now, what's the point of having carotid siphon? Why internal carotid artery is making a carotid siphon? I mean, if you look at cavernous sinus from the lateral view, if it is a side view of the cavernous sinus, what I'm saying is that internal carotid artery will run something in this fashion. And this loop of internal carotid artery is called as the carotid siphon. This is called as the carotid siphon. Well, there is a reason for the carotid siphon, guys. Internal carotid artery was a direct continuation of common carotid. Something we discussed while we talked about the carotid sheath content, that common carotid artery will continue as internal carotid artery. Example of vasculogenesis. So you can assume that the blood pressure in the internal carotid artery is quite high. I mean, it is a direct continuation coming from common carotid as internal carotid, and you cannot give the blood to the brain with such a strong pulsation. The very strong pulsation we have in internal carotid. So to dampen those pulsation, to reduce those pulsation, the internal carotid artery goes up, it makes a loop like this, and then it goes above. So that's an advantage of having a carotid siphon. It dampens the pulsation of internal carotid. It just dampens the pulsation of internal carotid. Why I'm telling you about the carotid siphon here itself? Because the internal carotid artery, which is inside cavernous sinus, after making this loop, goes above the cavernous sinus also. That's why you will see this ICA twice in the relation, once inside and then above the cavernous sinus, along with optic chiasma. So in the roof, the two main structure that you will appreciate is the internal carotid artery along with the optic chiasma. It's very important to understand this diagram. So medial relation is all about the sella turcica, sphenoidal air, sinus, pituitary gland. That is all in the medial relation. Lateral relation, we have one more thing I'll tell you. But before that, third nerve, fourth nerve, and ophthalmic nerve. And just forget about the maxillary nerve, of at least for your PGME thing. Inside cavernous sinus, we got sixth nerve and internal carotid artery. The sixth nerve, remember, it is inferior lateral to the artery. It's inferior and lateral to the artery. The same internal carotid artery was inside because it came through the foramen lacerum. And now it is above also, along with optic chiasma, after making a carotid siphon. So that's a lateral, medial, superior, inferior, can say floor and roof relation you can see in here. Before I write down this relation, because it's very important to write it down as well, I wanted to look at this picture, guys. Although this picture is taken from the Netters and it is based on the same old concept, the four nerves are shown in the lateral wall, but we still stick to the three only. So the three nerve in the lateral wall, this is a third nerve, right? This thinnest cranial, that is a fourth nerve, and this here is the ophthalmic nerve. And as I said, let's not talk about this nerve. The maxillary nerve, as per new edition, it says it is not in the lateral wall. Inside, look at this is sixth nerve clearly, and that is internal carotid artery. You can see sixth nerve and internal carotid artery, and you can also appreciate that sixth nerve is below and lateral to the inferior lateral to the artery. And you again see this internal carotid artery above, along with the optic chiasma. That's an optic chiasma and internal carotid artery, they are above. Medially, that obviously is the pituitary gland. This here is sella turcica. These are the sphenoidal air sinuses. So these relations are quite clear from here. When I say third nerve, fourth nerve, and ophthalmic nerve, they are present in the lateral wall. They are present in the lateral wall. But what is outside cavernous sinus? That also is a lateral relation. Now, if you look at this gyrus here, guys, the gyrus that you see on the lateral side of cavernous sinus is called as uncus. It's a part of cerebrum. We'll discuss in the neuroanatomy. Uncus is the primary olfactory area. And that primary olfactory area is present just lateral to the cavernous sinus. So let's write down these relations before we go any further. So starting with the medial relation is the pituitary gland. Sella turcica and sphenoidal air sinus. Lateral relation includes third nerve, fourth, and ophthalmic nerves. Plus, we just said uncus. Uncus, primary olfactory area. This uncus, I'll be showing you this uncus in the neuro part. Uncus is just lateral to the cavernous sinus. Roof is having internal carotid artery and optic chiasma. Floor, foramen, lacerum. Inside cavernous sinus, we said we got a sixth nerve, and we have again internal carotid artery. Now what is left, guys? Because it was a coronal section, so I can just see the relation lateral, medial, roof, floor, and inside. I cannot see the anterior and posterior relation of cavernous sinus. Now, don't have to draw it as such separate, but if I very quickly try to show it, if this was the middle cranial fossa, let's say here is the middle cranial fossa, and this is the posterior cranial fossa. So, where was the cavernous sinus? It was situated something like this. This was the situation of cavernous sinus, right? And just anterior to cavernous sinus, this is the point where we have the beginning of superior orbital fissure. So I can say that anterior relation of cavernous sinus is superior orbital fissure. It's very, very important relation. It's a superior orbital fissure. Whereas posterior relation, if you come to the posterior side, we got petrous temporal bone present here, right? That's a petrous temporal bone here. Let's say there's a petrous temporal bone which can be seen apart in the middle and the posterior cranial fossa, guys. So posterior relation is the apex of petrous temporal bone. Posterior relation is the apex of petrous temporal bone. The same apex of petrous temporal bone to which a sixth nerve was related. Remember that we said abducens nerve will ascend upward and it will be related to a sharp margin of apex of petrous temporal bone. That is a posterior relation of cavernous sinus also. So I just drew this rough diagram to show you the anterior and the posterior relation of cavernous sinus, which now completes all the relation: anterior, posterior, lateral, medial, roof, floor, and inside. What is very important to be noted here, that because anterior relation of cavernous sinus is superior orbital fissure. Now see how it all is connected. Anterior relation of cavernous sinus is superior orbital fissure. What is the content of the cavernous sinus? Internal carotid artery. So imagine if there is an aneurysm of internal carotid artery and that aneurysm ruptures. So obviously now there is a direct communication between the internal carotid artery and cavernous sinus. The blood is directly leaking into the cavernous sinus. So we call it what? Carotido-cavernous fistula. That is a carotido-cavernous fistula. That's the rupture of the aneurysm of internal carotid inside cavernous sinus. If the carotido-cavernous fistula is formed, so every time the internal carotid artery will pulsate, that obviously the entire cavernous sinus will also pulsate along with it. And because anterior relation of cavernous sinus is superior orbital fissure, so it will also push the content of the orbit. So we'll also see the eyeball is also pushed every time with the pulsation here. And that is what you call as what? Pulsating exophthalmos. You call it pulsating exophthalmos. That is because of the carotido-cavernous fistula. So a clinical that we can understand by understanding that the anterior relation of cavernous sinus is superior orbital fissure is if ICA aneurysm inside cavernous sinus ruptures. If ICA aneurysm inside a cavernous sinus ruptures, that will lead to what? We said that will lead to the carotido-cavernous fistula. That will lead to this condition, that is a carotido-cavernous fistula. And because of this carotid-cavernous fistula, we know that we have anterior relation superior orbital fissure that can lead to the pulsating exophthalmus. Pulsating exophthalmus. I hope you understood why. Because of the orbit contents are being pushed forward with the cavernous sinus, and cavernous sinus is in direct communication with the internal carotid artery. So that concludes the cavernous sinus for us. We already discussed the tributaries, the incoming and the outgoing channel, in which superior ophthalmic vein was the important one, as it was incoming as well as outgoing channel. Then we saw the relations of cavernous sinus. All relations are important, and specifically the anterior relation, being the superior orbital fissure, is the most important. Looking at the recent trend, they've also been asking questions, a little detailed question, in fact, on the nerve supply as well as blood supply of the cranial dura mater. So I'm going to discuss the nerve supply and the blood supply as well for the cranial dura. It's important also because especially the nerve supply is important. The pain of meningitis is carried via the dura mater, from the dura mater only. Arachnoid and pia mater are devoid of pain fibers, so we don't feel pain through the arachnoid or pia. It's the dura mater only which is having a pain fiber. So when you talk about the pain of meningitis, we basically are talking about the pain elicited from the dura mater only. And that's why the dural innervation is an important thing to understand. So let's first start with the nerve supply and then we'll go to the blood supply part. Well, again, to keep it simple, let's draw a very schematic picture here. These are three cranial fossa. Let's say the anterior cranial fossa, here we go. Middle and the posterior cranial fossa. And let's say this is foramen magnum. Let's consider this as a midline so that we can just discuss it on one side. And just for the reference sake, here we have the cribriform plate. I hope you know the cribriform plate, which is giving passage to the olfactory neurons. That is cribriform plate present in the anterior cranial fossa. Cribriform plate, part of ethmoid bone only. So three cranial fossa, guys. This here is, let me write that, it is anterior cranial fossa. This one is the middle, and this is posterior cranial fossa. Okay. Dural innervation. Obviously, the main nerve supplying the dura mater is a trigeminal nerve. And in the trigeminal nerve, ophthalmic, maxillary, and mandibular, all three have some contribution. Like the adjacent part, and please listen to what I say carefully. When I say adjacent part of anterior and middle cranial fossa, that means some part in the anterior and some part in the middle cranial fossa, the dura mater here is supplied by the maxillary nerve. Now you might say we have not discussed this, and in the maxillary nerve, doesn't matter. You know, maxillary nerve, when it comes out of foramen rotundum, before it comes out of the foramen rotundum, it gives a branch which goes back, and that supplies the dura mater. So maxillary nerve is supplying in here. Anterior cranial fossa close to the midline or close to the cribriform plate, this portion, the one which I'm highlighting right now. This is anterior cranial fossa, and that is the portion close to the midline. This area is supplied by the branches of ophthalmic nerve. And you know which one, guys. If you remember, ophthalmic nerve was dividing into frontal, nasociliary, and lacrimal. The three branches. Out of which nasociliary nerve was giving off anterior ethmoidal nerve and posterior ethmoidal nerve. So both those anterior and posterior ethmoidal nerve, they go into cranial cavity, into the anterior cranial fossa first, and then they go into nasal cavity. So that means obviously any nerve going into cranial cavity is to supply dura only. So if I have to be more specific, in the ophthalmic nerve, it was the anterior ethmoidal and posterior ethmoidal nerve which is supplying the dura. Now we have one more contribution of ophthalmic nerve, which I cannot show it to you here because we are considering the cranial fossa after removing the falx cerebri and tentorium cerebelli. So we're just looking at the dura mater present in the floor of the cranial cavity, right? Now, what do you expect to see here in this? Although it is in the posterior cranial fossa, guys, which dural fold is present in the posterior cranial fossa? That was tentorium cerebelli, right? There's a tentorium cerebelli. Although ophthalmic nerve has contribution to supply it in front, in the anterior cranial fossa, but there is a branch of ophthalmic nerve which even comes back and supplies a tentorium cerebelli, and that is called as a nervi tentori or tentorial nerve, simple tentorial nerve. So ophthalmic nerve through its division again ophthalmic nerve through its division, what division? That is called as a tentorial nerve. Tentorial nerve or nervi tentori. Tentorial nerve or nervi tentori is like tentorium cerebelli. Supply tentorium cerebelli. This could be a potential question because tentorium cerebelli is in the posterior cranial fossa, and every time we think of ophthalmic nerve, it is very much close to the anterior cranial fossa. So this is a nerve which goes back actually and then supplies the tentorium cerebelli. Okay. The next nerve, guys, that is the I'm not drawing the tentorium cerebelli here, of course. The next nerve is the major nerve supplying the dura mater. I hope you remember foramen spinosum. The foramen spinosum, which was giving passage to the ophthalmic, which was giving passage to the middle meningeal artery as well as to the meningeal branch of mandibular nerve, or you can say nervus spinosus. So that nervus spinosus, when it comes back through foramen spinosum, it is going to supply the dura mater of the remaining middle cranial fossa. That's a big area here. And also the lateral part of anterior cranial fossa. Look at that. So everything that I marked in yellow here, it is all by the mandibular nerve. Specifically, what branch of mandibular nerve? That is the nervus spinosus. Nervus spinosus. You already know about the nervus spinosus, which comes back from the foramen spinosum. And that's a dominant nerve. You can clearly see it's a dominant nerve supplying the dura mater, middle cranial fossa, and the lateral part of anterior cranial fossa also. In the posterior cranial fossa, the nerve supply, it is defined with respect to foramen magnum. That's foramen magnum in the center, right? So guys, the area which is away from foramen magnum is supplied mainly by the cranial nerves. An area which is close to the foramen magnum, it is mainly supplied by the spinal nerves. So if I say, let's say, let me highlight this area here, the area which is away from foramen magnum. This area in the posterior cranial fossa only, I'm talking about the area away from foramen magnum, it is supplied by the cranial nerve, and those cranial nerve, they could be the branch of 7th nerve, 9th nerve, 10th nerve, and even maybe 12th nerve. Now let me tell you here, 7, 9, 10, 12. We may or may not have discussed, doesn't matter. So we have some small branches of all these nerves which are also supplying the dura mater of posterior cranial fossa. 7, 9, 10 and 12. So facial nerve also supplies the dura mater. 7, 9, 10. This is okay. 12th nerve, like you might think how 12th nerve can supply dura mater. 12th nerve is a motor nerve which supplies tongue muscles. Well, 12th nerve is supplying the dura mater, but again there's a hitchhiking there. The cervical nerve, the first cervical nerve, it hitchhiked with the hypoglossal nerve and supplied the muscle. We saw that genioglossus thyroid. The same C1 nerve will join with the hypoglossal nerve and go back into cranial cavity also. So again, when I say hypoglossal, I'm mainly talking about the C1 fiber via hypoglossal. And those areas which are present close to the foramen magnum here, they are supplied by the cervical nerves. They are supplied by the cervical nerve. C1, C2 and even C3 nerves. The cervical spinal nerves are the one which are supplying the dura mater. So trigeminal nerve, guys, and as you can see from this diagram, see there are kind of questions in which just reading theoretically won't be enough, because if you have even schematic diagram in front of you, you can answer certain questions. Like, let me just throw some examples to you. If the question is asked that floor of which cranial fossa is not supplied by the trigeminal nerve, so I can say posterior. Posterior floor has no contribution from trigeminal nerve. Anterior is there and middle is there. If the question says which cranial fossa is supplied by all the 3 divisions of trigeminal nerve, ophthalmic also, maxillary also, mandibular also. Because if I ask this question before discussing this topic, many might say middle cranial fossa should be the answer, but it's not. It's not the middle, because middle is only having the maxillary nerve and it is having the mandibular nerve. But if you look at anterior cranial fossa, it is having the contribution from all the three nerves. So the only cranial fossa, dura mater of which is supplied by division of ophthalmic, maxillary as well as mandibular nerve, your answer would be anterior cranial fossa. Anterior cranial fossa. What basic and general questions are asked on the dural innervation is that which of the following nerve supplies the dura mater and which doesn't supply the dura mater. Simple. So if I say in total, guys, we have 5. Obviously 5 has a dominant part. 5, 7, 9, 10, 12, C1, C2, C3. Overall, you should remember these nerves 5, 7, 9, 10, 12, C2, C1, C2, C3 are supplying the dura mater. And because I'm writing C1, so I should tell you one more very interesting thing about C1. You know, C1 is the only spinal segment. It is the only spinal segment with no dermatomes. It's the only spinal segment with no dermatomes. Now, people misread this information at times. When you say dermatome, obviously talking about the innervation to the skin. When you talk about the dermatome, guys, we have dermatome for C2, C3, C4. Upper limb is having like C5, C6, and there are so many important dermatomes we have. And for every other spinal nerves, there are dermatomes. So they must be supplying skin somewhere in the body. C1 is the only spinal segment which do not have any innervation to the skin. But does it mean it is not sensory? No, it is sensory. It is definitely sensory. It is supplying dura mater. You can see the C1 fibers are supplying the dura mater. I'm saying it is the only spinal segment with no dermatome. So it doesn't supply the skin. But that doesn't mean it is not sensory. It is sensory also, and it supplies dura mater here. So don't mix up the two information. Yes, C1 do have sensory fibers, but it do not have sensory fiber for the skin. So there are no dermatomes for C1. And finally, in the cranial dura mater, the last thing that we're discussing here is the blood supply of the cranial dura mater. So guys, let us talk about the blood supply part. Now this topic is again in a way important. Obviously, one, because it has been asked in a recent time about the blood supply, which blood vessel is supplying in which cranial fossa and which one is not supplying there. So accept kind of questions they ask. And there are certain blood vessels which place like naughty. I mean, those blood vessels are not going into the cranial cavity through one foramen. So they choose multiple foramen to get inside. So they're supplying like dura mater of not one, but more than one cranial fossa. So for that, once again, let's draw this and the cranial cavity. Anterior cranial, middle cranial, and posterior cranial fossa. And once again, this is foramen magnum. And once again, this is cribriform plate, right? So I'm just writing again the cranial fossa on this side. There is anterior, middle, and posterior cranial fossa. So let's talk about the blood supply and which arteries are supplying it. The few arteries are quite obvious that where they're gonna supply. Like when you look at the cribriform plate, on the sides of the cribriform plate, we have ethmoidal foramen. So we have anterior ethmoidal foramen and posterior ethmoidal foramen. So obviously from those foramen, not only the nerve, the arteries are also coming out. So if I start from here, that in the anterior cranial fossa, it's the anterior ethmoidal artery as well as posterior ethmoidal artery are supplying it. And where they're coming from, anterior posterior ethmoidal artery are the branches of ophthalmic artery. They are the branches of ophthalmic artery. Just like the nerves for the branches of ophthalmic nerve, arteries are the branches of ophthalmic artery. In the middle cranial fossa, think of main foramen, guys. First, cavernous sinus was in the middle cranial fossa and it was placed on the foramen lacerum. So from where you can see the internal carotid artery coming out. So on this big internal carotid artery will be there. Directly I'm talking about. It's a main internal carotid artery coming in. We have foramen ovale and foramen spinosum also in the middle cranial fossa. Foramen ovale, if you remember the mnemonic M-A-L-E, male, M-A-L-E. A is what? A is accessory meningeal artery. So from foramen ovale, you will see the accessory meningeal artery coming out. And from the foramen spinosum, the main, that is middle meningeal artery will come out. So we got accessory meningeal artery. And then we have this middle meningeal artery. Now, middle meningeal artery, as I already said, it's a major artery supplying the dura mater, so it is having a huge contribution. As soon as the middle meningeal artery goes in the cranial cavity, it gives off an anterior division and posterior division. We call it the frontal division and parietal division. And the frontal division of this artery is going toward the anterior cranial fossa also. Is going to the anterior cranial fossa also. Let me just make a small sign here and write about it. That branch over there is the anterior, or you can say frontal division of which artery? Middle meningeal artery. And guys, it's the same frontal division of middle meningeal artery which is in relation to the pterion. A very recent question in the exam in INICT only, pterion. So frontal division or the anterior division of middle meningeal artery is in relation to the pterion. You know pterion, the meeting point of the four bones here. So that is where we have the relation of anterior division or the frontal division of middle meningeal artery. So which tells me middle meningeal artery is not only supplying the dura mater of the middle cranial fossa, but also going into the anterior cranial fossa, right? Okay. Then we have, let me just go to posterior cranial fossa first. The main artery that you see entering through foramen magnum is going to be the vertebral artery. Vertebral artery. And the vertebral artery also gives off the meningeal branches. To be more precise, vertebral artery is which part of vertebral artery? It's a fourth part of vertebral artery. We'll discuss the first, second, third, fourth, where those parts are. It's a fourth part of the vertebral artery which is seen in the cranial cavity and do supply the dura mater of posterior cranial fossa through meningeal branches. Now, one small artery which is having branches coming out of the foramen lacerum also, from the hypoglossal canal also, from the jugular foramen also, multiple foramen. That is the meningeal branches of ascending pharyngeal artery. We'll discuss these arteries next. That is our next topic. So we have foramen in the middle cranial fossa, we have foramen in the posterior cranial fossa, and they are giving branches. They are giving passes to the branches of this artery. Meningeal branches of ascending pharyngeal artery. Meningeal branches of ascending pharyngeal artery. Meningeal branches of ascending pharyngeal artery, which we're going to discuss in a while, is also supplying the dura mater of middle as well as posterior cranial fossa. See, what is important here is to understand that arteries which are going beyond one cranial fossa. So you can see middle meningeal artery supplying middle as well as anterior cranial fossa. Accessory ascending pharyngeal artery supplying the dura mater of middle as well as posterior cranial fossa. The question I remember from in the AIMS was they gave the branches of the main artery, that this major artery is not supplying the dura mater of which cranial fossa. Like if I go in more detail into more so anterior ethmoidal and the posterior ethmoidal artery branches of ophthalmic artery, guys, and we know ophthalmic artery is a direct branch of internal carotid. So in a way I can say anterior cranial fossa is having a contribution from internal carotid. Accessory meningeal artery, middle meningeal artery, they both are the branches of maxillary artery. They are the branches of maxillary artery, which again we're going to discuss. And guys, maxillary artery is a direct and the largest branch of external carotid. It's a branch of external carotid, right? Meningeal branch of ascending pharyngeal artery. This ascending pharyngeal artery is a direct branch again coming from external carotid artery. It's a direct branch of external carotid artery called as ascending pharyngeal artery. And vertebral artery, as we all know, is a branch, direct branch from the subclavian artery, first part of subclavian artery. So if I just roll my eyes on the major arteries here, so internal carotid, external carotid, and subclavian artery, they're all supplying the dura mater. But which one is where? Like internal carotid artery contribution is in the anterior cranial fossa and in the middle cranial fossa also, because the main internal carotid artery is there in the middle. So internal is there in the anterior and middle, but not in the posterior. External carotid artery is supplying anterior cranial fossa through the middle meningeal artery, middle cranial fossa, and also posterior cranial fossa. So I would say out of all the three major branches, it's the external carotid artery branches which are supplying the dura mater of all three cranial fossa: anterior, middle, as well as posterior. Anterior, middle, and posterior cranial fossa dura mater is supplied by the external carotid artery, by the branches of external carotid artery. So that concludes the cranial dura mater for us. Many times people discuss the cranial dura mater along with the other meninges in the neuroanatomy, but I want to discuss it with you here itself, so that the sequence that you're following is going to help us in the other topics also. Because when we talk about the blood vessels, let's say on the face, I should know how the dangerous connection is formed between the veins on the face and the cavernous sinus. So we have to know this part here itself. So this is about the cranial dura and about the dural blood supply and the innervation.